If you're watching this video, you probably are experiencing some type of back pain right now. This video is specifically designed to help get you out of pain and moving a little bit more freely with less apprehension or with less discomfort. So I'm going to use the table. You're more than welcome to lie on the floor. If you're in so much pain you cannot get on the floor, you can always lie on your bed. I'm also going to use this light step here. If you are able to get on the floor, a comfortable position might be to rest your shins on either an ottoman or the sofa. So if you need to pause the video to get something or move yourself for somewhere that you can put your feet, go ahead, and then we're going to get started. So you're going to lie on your back with your shins on either the sofa, the ottoman, whatever it is. If you don't have anything accessible like this, you can just lay on the ground with your knees bent and your feet on the floor. This 90-90 position is a nice decompressed position for the spine. Okay, so first you're just going to start with your palms facing up. Kind of settle in here, let the shoulders fall down towards the floor. And then I want you to place one hand on your heart and one hand on your stomach. When we are in a lot of back pain, whether it just happened or we've been experiencing it for a while, our nervous system is affected, our posture is affected, and that ultimately affects our breathing pattern and our rib cage. And that's really where we want to start this process of healing, is bringing awareness to our breath, our diaphragm, and our rib cage. So as you breathe, I don't want you to do anything other than just take notice of your current breathing pattern. Are they short, fast breaths? Are they long and slow? And now try to see which hand do you feel movement under. Do you feel movement under the hand that's on your belly or movement under the hand that's on your chest? Whatever the answer is, that's fine, but we're going to shift our breathing so that only the hand underneath our belly moves. As you inhale, you're going to push your belly into your hand, feeling it expand, and then exhale, let the belly fall. So by doing belly breathing, we're allowing our diaphragm more movement, more blood flow. Inhale, belly expands. Exhale, belly falls. So I'm going to move my hand so you can see what it looks like. Inhale. And exhale. Inhale, belly rises. Exhale, belly falls. This may seem simple and silly if you're used to doing this, but it also may seem difficult if this is a very foreign concept to you. If it is challenging, then that just means it's even more important. Okay, next we're going to place our hands on our hips here. So we want to put our hips, our pelvis, in a neutral position. We want to be aware of the relationship between our hip and our rib cage. So the first thing you're going to do is lift your lower back up so you could kind of stick your hands underneath the lower back. It's like we're kind of dumping our hips forward. And then I want you to press your lower back down so much that your butt almost comes up, but it doesn't. So we're kind of like tucking our hips or butt under. Call this a posterior tilt. And then lift the lower back, kind of tilt the hips up and forward, anterior tilt. Good, smush the lower back down, barely lift the butt. Lift the lower back up, tilt the hips forward. So we're putting our pelvis in two extreme positions. Posture, whether we're sitting all day or we're standing all day, we tend to get stuck, whatever your lifestyle is. we get stuck in one of the two, and that affects our breathing, that affects the stress on our spine. And so when we revisit our breathing, we're going to do it in a neutral position, but you don't know what neutral is until you feel the two extremes. So one more time, dump the pelvis forward, create that space in your lower back. Smush the lower back down as like you're kind of almost about to roll the hips off the table. And now find somewhere in the middle. One hand on your heart, one hand on your stomach. 10 deep diaphragmatic breaths. So belly into the hand as you inhale. Belly falls as you exhale. We're really going to take our time. I'm not going to rush you through this. I know it seems like eternity, but when you're in a lot of pain or you've been in pain for a long time, this simple step is really important. One more. Relax. If you have your legs propped up on a sofa or an ottoman, you're just going to interlace your fingertips behind the right knee. And then if you're laying on the floor, you're just going to lift your knee up towards your chest. Again, place the fingertips behind your knee. Bend and straighten this right leg. Sometimes, whether it's a nerve involvement at the spine, nerve involvement being compressed in a muscle in the hip, the sciatic nerve can get irritated. And so this just gives that nerve a little bit of movement. This time, straighten the knee, pull the toes towards you, point the toes, bend the knee. So straighten the knee, toes towards you, point the toes, bend the knee. A couple more. You can start to put those two moves together. It also starts to get some movement to the hamstring, a common culprit when tight that pulls on the pelvis or pulls on the hip bone, contributing to lower back pain. Okay, let's switch. Fingertips behind the left. So on the left side, just start by bending and straightening the knee first. If you'd like to jump into that nerve glide right away, you can by adding the ankle. If you just want to loosen up the hamstring to start, and then add it in. One more. Okay, next up, an easy spinal rotation. There's a lot of variations and levels or advancements for spinal rotation. We're just gonna start super simple. Separate the feet a little bit wider, arms out to the side, and then we're just gonna windshield wiper those knees right to left. So if you're in a big flare-up right now and you're in a lot of pain, this could cause, some increased symptoms. Just do your best. Make sure we maintain that deep, intentional breathing. Good, back to the center. Hug both knees into your chest. Release the left, hold on to the right. And we're just going to make circles with this right knee. And then switch, release the right, hug the left knee in. Make circles right to left. Hug both knees into your chest. You're going to roll over to your side. We're going to flip over to your hands and knees. We're going to start to take our spine through as much movement as we can, depending on what is going on in your body. One of the two directions could be painful, but it's not always going to be the same depending on what's going on. So listen to your body. You're going to back off a pinching sensation and kind of work through a pulling sensation, as well as back off anything that causes symptoms down your leg. So just nice and easy here. We're just going to start to move the lower back. So if we think back to when we were lying on our back and we were doing that movement with our hips, it's the same thing here. Okay, we really want to get the lower back and the pelvis, your hip bone, moving and not just move through the upper body. If you want to start to add in more of the spine, go ahead. We're going to round through the upper back, chin, tuck the butt under, and then lift the chest, look forward, stick the butt out. Continuing to breathe. We're going to start to sync our breath with the movement. So let's start in a neutral position. As you tuck your butt under and you start to round through your upper back, I want you to take a deep inhale. Feel your shoulder blades separate from each other. Feel your spine kind of push towards the ceiling. The rib cage expands, the lungs fill. And then exhale, allow the chest to fall. Lift the hips and relax. Inhale, fill the belly, fill the lungs, let the rib cage expand. Exhale. One more time. And exhale. Separate your knees slightly. Sit the hips back towards your heels and let the arms rest forward. And then if you can, forehead down to the floor. Take a moment to just breathe. If your hips aren't touching your heels, that's okay. Just settle in wherever you can. Okay, slide the hands back towards your knees. Straighten out the elbows, look forward. Okay, so we want to find that neutral hip position. So we're going to do the two extremes and then pause in the middle. So again, similar to when you were lying on your back, you're really going to stick your butt out as far as you can. Now, if this is painful, back off. The opposite would be tucking and rounding the butt under. We want to find a happy medium. And then you're going to contract your glutes, squeeze them, and then rock the hips forward slightly, and then relax and sit back down. And we're just going to pulse up and down, trying to keep this neutral, decompressed spinal position. So from here, I'm going to squeeze these muscles. They're going to rock me forward, and then relax and sit back. One more time. And then let's relax back down into that child's pose position. Next, we want to introduce some movement to the spine in standing. Movement is a lot more tolerable when you're laying down. as opposed to the demands of gravity when you're standing. So sit on the edge of a chair, knees wide, enough room for your chest to come down the middle. You're going to let your hands kind of rest in between your thighs or on your thighs. Tuck your chin, let the shoulders round forward, and then reach for the floor. So this is the same movement of your spine in standing, except it's a little bit easier, less demands of gravity. And then roll it back up. Pull the shoulder blades back, rest the fingertips on the thighs, look up, and then round. So the easiest version of creating movement within our lower back, we started with laying on our back with our legs elevated, right? We were just doing this, kind of tilting the pelvis, but getting a little bit of movement from the lower spine. Then we progressed to hands and knees, which is a little bit more demanding. And then this would be level 3, standing would be level 4. So depending on how flared up you are, the severity of pain, your sensitivity to movement, whichever level you're at right now, it's okay. You just have somewhere to progress to. For this next exercise, you can back yourself up against a wall. I'm just going to use the table here. Soften your knees. You're going to place your hands on your knees and then slowly just start to slide your hands down your knees, allowing your back to round, and then drag your fingertips back up. So if you're in a big flare-up, it might look like this, where you're actually going into that hinge pattern because your body is guarding and protecting your spine. First thing I want you to do is to just be aware of what's happening. Try rounding your back, chin to chest, round the shoulder blades, bend the knees, and then try to slide those fingertips down. If that is not happening for you right now, so a couple tips, things to remember as you are either recovering from a flare-up or tired of work or tired of dealing with constant lower back pain is movement frequency is key. We really want to get blood flow and movement to these muscles that are really stiff, and doing a little bit of movement 5, 6, up to 10 times a day is a lot more beneficial than doing 45 minutes of movement once a day. So I encourage you to either repeat this video as many times as you can, morning, afternoon, evening, and then pick just a few of the exercises to kind of sprinkle in throughout the day just to keep you moving. I highly recommend heat and not ice, especially if you're in a flare-up or you just, kind of threw out your back or you pulled something. Ice is going to cause everything to stiffen up, and you're already walking around super stiff, right? You kind of feel like a robot. You're scared to move. That ice is just going to kind of constrict everything and make you feel even more stiff. So I promote heat, movement frequency, and of course, lots of water to stay hydrated and make sure everything is working as efficiently as it can. If you have any questions, please let me know. Again, this video is designed to help you just feel better right now. If you're interested in how to progress further and how to prevent the pain from coming back, you can schedule a 15-minute phone call. Just reply to this email.